Welcome once again, friend. Myself, Dr. Johan, and today I'm back with a new topic in the field of ENT. And today's question is: a diagram has been shown of the oral cavity of a newborn child, and we have to identify the two lesions, two small, purely white lesions shown on both sides of palatal raphe. So the lesion marked with a green arrow, we can also say that we have to identify this lesion and named it, and we will discuss about its course, what is its treatment strategy, what is the management protocol for this lesion, and what causes this lesion. So first of all, we have to identify it. It's a very interesting case, and the parent will come to you very anxiously asking about and curious about this pathological condition in a newborn child. Some will say either it is the early erupted tooth, some small abscess cavities, etc., etc. Many differentials has been made out of this, but the exact answer for this question is the lesion which has been shown in this diagram. Actually, the lesion is known as Epstein pearl. The lesion is known as Epstein pearl. These are small, benign, self-resolving nodule commonly found on the oral cavity of newborn. So these are commonly found in the oral cavity of the newborn. They are benign in nature. They are self-resolving and small. They range usually in the millimeters, from few millimeters to from 0.5 millimeter to 1 millimeter in size. So coming on to the next slide, which says that these are observed in nearly 60 to 85% of the newborn infant. I will say that very few have aware from this condition, that they are observed in nearly 60 to 85% of the newborn infant, and they are more common in multigravida and with high birth weight. So two condition has been found associated with this. One is if the lady who is giving birth to a baby is multigravida and the baby is born with a high birth weight, then the chances of being seen in the oral cavity, the Epstein pearl, is raised to a higher degree. And now coming on to the theories which has been postulated for responsible for the appearance of Epstein pearl. So one theory says that we know that these are two palatine cells, one from the right side and one from the left side, and they are fused in midline. So if epithelium is trapped between the palatal cells and the nasal process, then this can result as a small purely white nodule. They will be known as the Epstein pearl, which is the epithelium entrapment theory. And second theory is usually based on the minor salivary gland. We know whole of the palatal area is covered with the small salivary glands. So if these are the epithelial remnant arising from the formation of minor salivary gland, so these two are the most commonly accepted theories. One is they arise from the minor salivary gland, other is the epithelium entrapment theory. Now coming to how they appear. So as we have seen in the diagram, they appear as a small, opaque, whitish yellow lesion adjacent to the mid-palatine raphe, as in the shown in the diagram. They are lined by stratified squamous epithelium and range from 0.5 mm to 1 mm in size. So one thing we have already discussed in the summary in the first slide, that they are benign and asymptomatic. So that's why most of us were unaware about the thing that they are found in 60 to 85% of the infant because they are benign and asymptomatic, and they do not interfere with feeding as well as the tooth eruption. The feeding and tooth eruption. So there is no treatment at all required, neither removal, no medical treatment. They will resolve by themselves. So one differential diagnosis that is most commonly seen associated with have to discuss in this. Most common differential diagnosis is Bowen's nodule, BOHN Bowen's nodule, which can be asked in the NEETPG exams as well as the other Viva exams of the ENT. So what is the differential diagnosis for our Epstein Barr? That is the Bowen's nodule. So these are the mucus gland cyst. What? Mucus gland cyst that appear on the alveolus of the nose. These are the mucus gland cyst that appear on the alveolus of the newborn. These are seen in the diagram. These are mucus gland cyst which appear on the alveolus of the newborn. So Epstein Barr should be differentiated from this. This concludes our today's topic, that's the Epstein Barr. If you like the video, kindly share and subscribe, and stay tuned for more such videos which are on the way. Thank you.